I got a question yesterday. Somebody asked me if you can stretch your sleeve, and if you did, what can you do to change it? Is there any way to kind of get that restriction back again? So the simple answer to that question is yes, you can stretch your sleeve. As you can imagine, stomach is a stretchable organ. Even though we remove about 70 to 80% of the stomach, with overeating and pushing too much food in there and not changing the eating habits, you are able to stretch that sleeve, or sometimes that restriction and control over your hunger may go away. However, there are some solutions. One, we can start with resetting your diet and eating habits, which means you go back to eating smaller portions, push the food away as soon as you feel that you're about to be full. What I usually suggest to my patients is to start with meat, whether it's going to be baked or grilled meat, could be chicken, beef, any type of meat that's lean, high in protein. Start with that. Chew your food really well. Take about half an hour to eat. And if you have any little room left, I would have some healthy vegetables. It is very important to wait at least half an hour after you eat before you start drinking any water or liquids. Because what happens is if you start drinking liquid, that's going to push down the food through the stomach, and then you have an empty stomach again, so you have more room to eat. That's the reason that a lot of people kind of don't feel that restriction anymore, because they forgot how to eat. Now, over time, as you go back to healthy eating, meaning smaller portions, more frequent, you could have little snacks in between your meals. If you really feel hungry, healthy snack. It could be a fat-free cheese, some yogurt, something that's going to keep you full, but it's not going to give you a lot of calories. So that's what you have to do to kind of reset your gastric sleeve, so it can still give you that restriction. You just have to change your eating habits. So what if you're still doing that and not feeling any restrictions? It is possible that you have stretched it to the point where it's just not giving you that restriction, or sometimes gastric sleeve may not necessarily work for everybody. Gastric sleeve works with just restriction. So in those scenarios, we kind of do go over your history as far as what kind of things you're eating throughout the day, kind of help you with your diet first. And then once we determine that you have already tried the diet that you're supposed to be on, and your eating habits are correct, you're watching your calories, then we can kind of do some testing, including EGD, where we take a look inside the gastric sleeve, stomach, endoscopically with some sedation, and evaluate the stomach, see if it's overstretched, and if it is, and you have already tried everything else, it hasn't really been working for you, then there are options to convert gastric sleeve to another type of bariatric surgery, which we consider those revisional surgeries. And those could include converting gastric sleeve to gastric bypass or duodenal switch, depending on the weight of the patient. Or sometimes endoscopically, we can also do endoscopic gastroplasty, which means endoscopically we go in, there's no incisions on the abdomen, but endoscopically we go in through the mouth, into the stomach, and then suture it tight. So it still gives you that restriction, kind of resetting your gastric sleeve again, but all done endoscopically. So those are different options, but what I would suggest is just first start with changing your eating habits, and if you do that for about a month, you might be able to actually reduce the size of the stomach slightly, and your body and brain kind of gets used to that again. So please post more questions if you have, and I'll be happy to answer them for you.